Hello, everyone, and welcome to another edition of your Rehab Power Hour. This is your community, as always, to engage in virtual rehab together and a place to discuss all things neuro rehab, from the science, the people behind it, and the individual journeys of recovery. I'm your host, as always, Dr. Nick Housley. Thanks so much for being here on this Friday afternoon / evening, depending on where you are in the country. Hopefully, you are having a great day, and I hope your week was very good. As always, we welcome anyone recovering from a neurologic injury, their friends, family members, or care partners, as well as their clinicians, to engage in this conversation with us today. We have a great show set up for you, and I want to just quickly thank everyone for being here so far. I'm going to go into the comments. I see we had a couple of bits of conversation going on beforehand, so I want to welcome Heather, as always, for being here. Stacy, thanks so much for being here. Dawn, it's great to see you as well. And so, as always, we have a couple of ways you can get in touch with me throughout the live stream today. The first of those is actually in the live stream, so I'll be watching that as we go on. And if you have any questions or comments for me, let me know. I'll be happy to answer your questions, whether they're tough or easy, whether about neuro rehab or the hand mentor or the foot mentor, or even something crazy. Tell me how things are going for you. I'm looking forward to hearing from you. You can also give me a call at 404-594-4244. You can call that number day or night and leave me a voicemail and be able to answer your questions or comments there, and whether it's about your hand mentor or maybe even an idea about a future Rehab Power Hour. You can also email me at rehabpowerhour@motusnova.com. Again, to drop suggestions to me, ask questions. And if you find this helpful or want to share this with any of your friends, feel free to like this and also share it with your friends. The support group is there really for you guys. And so I'm trying to be active in there as much as I can. I know it's getting pretty big and there's a lot of good content, a lot of good questions there, but I'll do my best to be in the support group and be answering questions you guys have. Also, if you'd like to be a guest on on future Rehab Power Hour, let us know. You can either drop me a line in the live stream here, or you can drop me an email and ask to come on. And we can do an assessment together, like we'll be doing today, or you can ask some questions about your individual hand mentor experience. Also, I want to remind everyone that we do have a live session going on right now. So if you are interested in doing another hour of rehab this week, feel free to power on your hand mentor or foot mentor, and you'll be able to see on the top right-hand side there is that join live session button. And sometimes it may actually pop up on an additional window too, so you're able to join that live session and enter you into an actual hour-long prescription that we can do together. If you don't have a hand mentor or foot mentor, no problem. Get your home exercise program out right now, and you can start doing those exercises, and we'll keep you company while you do it. The one thing I want to mention is always make sure you are engaged in it. Don't just put the hand mentor on and have it move you, and pay attention to me. Make sure you are doing the exercises, and we'll just keep you company in the background with some nice conversation. And also, I want to remind everyone that we do have a contest going on right now until the end of the month. That is, this is our first contest, and this is actually you can enter in to get a free month of your hand mentor, foot mentor subscription. And so, a couple of the rules here at a high level, everything all you have to do is really videotape yourself either doing a functional task or doing something with a hand mentor or foot mentor, and then submit that to, I think it's Ella Sophia or Ella.Sophia at motusnova.com. You can also put it to our Instagram messenger, and that will enter you in to the sweepstakes. A quick reminder, it should be under 60 seconds. And I think it ends as of, I think maybe next week at March 31st at midnight. So feel free to get your submissions in. Looking forward to seeing what you guys are doing with your hand mentors and foot mentors, or also what tasks you do. Are you picking up a can of soda? Are you closing a fridge like Heather was doing? Are you folding laundry? Let me know what you're doing. I'm really excited to see what's going on with you guys and how you guys are progressing. And hopefully we'll have this be kind of a regular occurrence. We'll be able to kind of track our progress together, and we'll be able to stay motivated together. So that's really, really going to be fun. And I also want to give some personal congratulations to a couple of individuals who have completed their 30-hour challenge the last couple of days. Actually, in fact, since Wednesday when we had our last Rehab Power Hour. So I'm watching everyone complete these, and it's always really fun to see when a new one comes in. So I want to congratulate Sharon M. in Illinois for completing, Susan in Arkansas, and Ivor, apologies, in Iowa for completing as well. So congratulations to the three of you for completing your 30-hour challenge. For those of you who are not familiar with that, 30-hour challenge is a way that you can kind of motivate yourself in those first month or so of getting rehab with a hand mentor or foot mentor. So if you're able to get to an hour of rehab a day, around 30 hours that first month, you'll be getting some really cool prizes sent to you from Motus. And we'll be switching things up a little bit. Right now, I think it was a t-shirt that was branded with, on the back, it said, "You are a 30-hour challenge champion." And so going forward, we might has some additional prizes, and we'll keep you abreast of when those things change. And also, if we venture into maybe even a 50-hour challenge or even a 100-hour challenge, we haven't done those yet, but we're looking forward to seeing what you guys can actually do in terms of the total amount of rehab. You guys are putting out some big numbers, and it's really exciting to see what you guys can do. And so, I want to just quickly welcome Robin and Jennifer. Thanks so much, guys, for being here. Hopefully, you guys have some great questions, and feel free to post them in the live stream here, and I will be answering them as we go along. Okay, everyone. So we can go ahead and get started, actually. With respect to our first spotlight user, I want to welcome George. George, can you hear me?
Yes, I can.
Excellent, George. Thanks so much for being here on this Friday evening. Well, tell me a little bit about you. What's your name, where you're calling from, and when you had your neurologic injury?
My name is George Forrest. I'm in Durham, North Carolina, originally from Hillsborough, close by here. I'll be 82 years old in August. I had a hemorrhagic stroke on May the 12th, 2 weeks in intensive physical therapy, 3 months, 3 times a week. And all the research that I have done, I have learned that for the brain to be stimulated to really generate the axonals and to rebuild that neural path, you need to have multiple repetitions a day, 400, 600 repetitions a day. And I was lucky enough to find the Motus Nova. I understand robotics, I understand artificial intelligence, and I immediately put the order in. It took a while to get it, but I did get it. And as I mentioned earlier, 2 boxes, unpack them, hook them up, turn it on, and it works without calling anybody for technical assistance or whatever. Although the questions I do have are related to being able to optimize
Sure.
these sessions and learn a little more about how the system changes as I use it. And also, I can't play Plinko. Why?
Okay, yeah, George, thanks for this. Yeah, I think there's a lot of things that we can get into here. But first of all, I want to say, couldn't have said it better myself. You're exactly right. You were actually quoting some numbers that were published in a paper that Dr. Wolf and I talked about at this point about 2 weeks ago. Randy Nudo, in 1996 papers identifying that we do need around 400 or 600 repetitions a day in order to induce those changes. And so you're exactly right, George. I'm really glad that you are getting that activity with a hand mentor, and hopefully we can start to induce some of those really positive changes. I want to ask you a couple quick questions though before we kind of dive into it.
Actually, I'm using the foot mentor.
Oh, foot mentor, excellent. Okay, very good.
Okay. Hemorrhagic stroke, right brain affects the left side. Yes.
Yep. So you're using left foot mentor. Okay, very good. And you said you had this your hemorrhagic stroke in May. Was that in 2020 or was that further back?
May 12, 2020.
May 12, 2020.
And the
okay,
brain,
very good.
The brain will try to heal itself and rebuild those neural pathways for up to a year or more, depending on what your own physical shape is. So, yes.
Yeah, very good. And I think one of those things I was going to ask you about is, when did you get your foot mentor?
Well, I have a piece of paper over here, but I can't find it. So,
well, just ballpark it. Have you been using the foot mentor for a week, a month?
Well, I've had it for almost a month, but
okay.
We had 2 deaths in my immediate family due to COVID. And so therefore I was not able to do it as often as I have. Right now, I have about 10 and a half, almost 11 hours into it right now. So,
understood. Yeah, well, I'm sorry to hear that, George. I think, COVID's been affecting many of us. And so,
So
yeah.
what I've come to learn and understand with my research and understanding is that spasticity, the neuroplasticity of the brain allows it to heal itself, but you have to motivate it to do that. And as a result of the stroke, I was able to get around, move, and even hobble around, walk, and so forth. But yet the limiting factor is that remaining spasticity and how to reduce it or eliminate eventually the spasticity in this left leg.
Yeah, understood. So I think these are great questions. And I think with respect to eliminating things, making, permanent changes, we're really hoping to reduce those, the impact of spasticity and tone. I say it's really, really hard just sitting here with the scientific data to know how any individual person is going to respond. I think we know kind of
Yeah,
the generalities how science works, right? We
of
know
course.
that it will help these sorts of individuals, and so I think we can always strive to be better. I think that's even true for individuals who don't have a neurologic injury. We can always strive to be stronger and faster and more resilient. So I think that's a common goal. So I think you had a couple of questions with respect to that you were mentioning before we jumped on Rehab Power Hour to start with. Tell me about those questions, and maybe those really specific ones.
Well, they're specific to the games
Sure,
with the Foot Mentor. Um,
sure.
the first question I talked to Matt about was he said Plinko is your favorite game, and the
Hmm.
thing is, one thing I did not know how to do is to play a solitaire with the Foot
Hmm.
Mentor. Okay, number two is I've generally been skipping it. I tried it, and maybe that's why Plinko is not coming up in the rotation of games. So right now it is activated, but I am not able to access it in my as I go through the games.
Sure. Well, maybe one thing we can do actually, George, is I don't know. Are you feeling? Let me give me a high level sort of review of how the movements are. Is it challenging? Is it too easy? That'll kind of tell me whether or not we need to do an assessment together.
Well, actually, it is. I'm motivated. Okay,
Okay.
so therefore, um, I use ultimate maximum effort in what I'm doing all the time, and so but I do understand that the Foot Mentor and the artificial intelligence built into this, it is not there to do it for you. You have to do that, and depending upon what the parameters are that are set in the program, when you put
Hmm.
effort either down or up, that
Yep.
only will activate the device when you cannot reach that full range of motion. It will kick in to help you do that. Is that correct?
That's very correct, and I would say you're. It's really good to hear that you're super motivated. I think that's one of the most challenging aspects of this, right? Because it's a hard process to do this recovery, and so I think that's a great characteristic that you have. And so maybe what we can do together is we can kind of go through this and see if it is challenging enough. I've talked about this before, and we had Power Hour. This idea of the concept is called sufficient stimuli, in which case it needs to be hard enough to induce those changes, George, that you were talking about. In which case, generally, that's the amount of movement that you're operating in, and potentially the amount of force that you're required to put out. And so, I think it would be helpful if we kind of walk through this process really quickly to kind of just it will give me an idea about how much movement you have, and also that will help me generate some of the prescriptions that would be best for you. So, if you wouldn't
Okay,
mind, we can go through that process.
absolutely. Well, I can tell you I've got a good range of motion, and what I've let me jump right to this. What I've noticed is that, for example, I was doing this at midnight last night,
Hmm.
and uh, the amount of effort it was taking to do the game. So that was the roulette, or not the roulette, but the your
The
pull the
slots.
hand slots. Thank you.
Yep.
Sorry. Anyway, uh, and also today in the temperature, the thermometer,
Yeah.
and so forth. So last night when I was doing this, then I had a full range of motion. Today when I tried to use the thermometer, I had a very limited range of motion. In fact, I could not even raise it more than, or maybe 10% of my whole range. So that was
Sure.
limited for some reason. And so
Well, I think what we can do, George, is we can actually go through and check what's going on. So let's go ahead and have you hit the assessment button on the right-hand side of your screen, and we'll go through and figure out what's going on.
let's do. Okay.
Very good. Okay. So I'm getting a sense here. It looks like there's some interesting behavior that's going on here on my side. And so I'll take a look at this. I'm seeing a plateau here around 20 degrees of extension. And this is indicative of potentially something going on. We'll see we'll see what's happening here. So George, what I'm gonna have you do, I'm gonna have you lift up your foot. Try to point your toes to the sky as far as you can go for me.
That's it right there.
Okay. And then I'm gonna have you then press down as far as you can go for me.
Yeah, I've been getting up to 24, or I've had a much wider range of motion than this. So obviously the resistance is set to where I cannot go beyond these points.
Yeah. The other thing too is that there can be, in certain situations, there can be issues with the sensors. Sometimes they can get reset or something like that. And so
Yep.
what we can do is we're just trying to figure out exactly what ranges you have to operate in. And
Yep.
so we will change this based on what ranges you can operate in. So what we'll see here is,
if you look at my
that's
history,
a good active range.
yeah, if
Go
you
ahead,
look
George.
at my history, you can see what the range has been previously.
Yeah, I did see that, George. That's very good. So one thing I want you to do now is just relax. I'm going to actually use the foot mentor to kind of move you through some range of motion. Okay.
Yep. Got it.
So we're going to kick in here. You may experience a little bit of movement. So
Nope,
let me
no problem.
know when you feel that.
Yep. The compressor is kicking in just a little
Very
bit.
good. Very good.
Yep. It's moving up slightly.
Okay.
Yep.
Very good. Okay. And what we'll do while we do this process, guys, I'm going to talk you through this. Again, this is the same sort of process we use for the hand mentor to assess passive range of motion, but also the amount of tone. And so, George mentioned some tone and spasticity being potentially present there, and I think it's good for us to check what's going on here. And actually, while I'm doing this, I can actually synchronously answer this question, I think from, who do we have this question from here? I think it was from Robin in our live stream here. Robin's asking, is it possible to get 30 hours in 10 days? I think David answered this question just fine, but it is exactly possible. I think getting 3 hours of therapy a day is a good target for some individuals. Of course, you want to build up to that naturally, but that is certainly possible. Okay. So George, let me know what you're feeling right now. Any issues?
No, none whatsoever. It's I've been in a neutral position. It's where the foot's down just a touch, but that's it. And I'm relaxed,
Very good.
so not trying to do anything.
Okay. Cool. Okay.
So do you have a way to kind of zero this out?
Yeah, we're going to see if we can do that. That's exactly right, George. So
I'm an old geek. So
no, you're good. You're good. Actually, George, what could be helpful is if you wouldn't mind, could you potentially turn the camera down so I can actually look at the foot mentor?
I can.
Excellent. So we can kind of get an idea of what's going on there. And can you point it down a little bit more so I can see like more towards the ground? Okay. Okay. And how about a little bit of a side-on shot for me? There we go. Okay. Okay. Very good. Now, George, let's go ahead and do something really quickly. I'm going to take the air out of this. What I'd like you to do is on the right and left-hand side of the foot mentor, you can probably see two rods that are sticking out.
I do. They're the pneumatic rods. Yes.
So I guess the question I'm going to ask you is, are you able to? So there should be two circular
black knobs on top.
Pieces. Yeah.
Yep.
Can you go ahead and potentially press two of those for me?
Well, there are two, one on each side. Correct.
Correct.
Okay. Push them simultaneously.
Correct. They should both click. And now
They
let's
did.
go ahead and have you try to move up into extension again for me.
Okay.
Very good. Okay. And then what I'm going to have you do the next thing is on the very, very far right and left-hand side, you can see two actual kind of pivot notches or pivot latches. Are they
towards the bottom of the box?
Correct. On the out, they should be blue little pivot latches. Are you able to press those in either direction?
Yep. That one went towards the bottom.
Okay.
The other one is, there we go.
Okay. Now let's try to move up again as far as you can. There we go. How about that? A little better?
Yeah. No kidding.
Okay. Very good. This can happen sometimes, George, when you are moving the foot mentor around. Those little latches can get bumped. So what those things do is those actually help to constrain the movements. And so this is probably one of the reasons why you were experiencing that sealing effect.
Okay, I got it. No worries.
Yeah.
Okay.
Very good.
Sure.
Well, so you can go ahead and relax for me then. And what we'll do is we'll go ahead and refine that range of motion again. Okay. So I
Sure.
already know you can move all the way up, but now we're actually able to access it all. Okay.
Good.
So I'm going to go ahead and do the same thing on my end. So just relax.
I am.
Very good. We'll come through and we'll find that passive range of motion again. Very good.
Sure.
You should be getting a lot more movement into that extension where your toes up.
Yeah.
Okay. Very good. Very good. Much happier with this, George. How about you?
Yep. Yep.
Okay.
We'll find out. Yeah. And my foot is almost parallel.
Okay. Is it comfortable, uncomfortable? Tell me what you're feeling.
It's very comfortable. And I'm in here, my knee, foreleg is at pretty much 90 degrees. So,
okay. Very good. Okay. All right, George. So what I'm going to have you do is I'm going to have this back out.
Okay.
Okay.
Yep.
It's going to drop out that assistance. What I'd like you to do now is go ahead. I'm going to put a little bit of assistance in here. I want to redo this on our third sort of step of assessment, but I want to evaluate what happens with some assistance. So this would be called active assisted range of motion. So from this position, go ahead and move down into flexion for me. So point your toe as far as you can for me. Very good. And that should be fairly tough. What do you think?
That is, I'm putting 95%. Well, I'm putting max effort.
Max effort. Okay. Very good. Keep pressing for me. Keep pressing.
Oh, sorry.
That's okay. Keep pressing. Keep pressing.
Oh, okay.
Very good. Still pretty hard.
Yes, it's what we call it a Navy 2 blocked.
Okay, very good. Yeah, here we go. Okay, we'll keep going. One more time. Push hard for me. Very good. Okay. Now I'm going to have you move up into extension from as far as you can. Move up into extension. Up. Very good. Okay. I'm pretty happy with this now. I think we figured out the technical issues. I think what we can do, George, is let's go through and troubleshoot some of those games. Okay.
Okay.
Very good. So what you can do on your side, you can hit the back button top left, and then you can go ahead and go to home and then begin therapy for me. And while you do that, I'm going to just check through your prescription really quickly. It does look like you have Plinko on. Tell me, what other games do you have on here that you like?
Well, I like all of them. So,
okay.
I'd have to go back to the home screen to see which games are on here again. So, because it shows me right on the front screen which games are enabled on here.
Sure. Well, what I'm going to do, I'm going to make a couple modifications here.
Well, I can go back to my home screen and I'll tell you.
Okay,
now.
Sure.
It is, come on, wiki. Okay.
There we go.
They are thermometer, slot machine, cosmic tennis, fishing.
Yeah, George, I can see that. So which of those do you like all of them?
You can see that.
Try new ones? I can see that. Yep.
Well,
now, do you like all of them? Are there ones you're more favorite of? Or do you like?
I don't play solitaire because I didn't know how to use it with my foot mentor, and I don't play Plinko because it's never come up in the rotation of games.
Interesting. Okay. Well, let's try to figure this out today then. Okay.
Yeah. Okay.
So I'm also going to potentially at the end of this add some new games for you. Okay.
That'd be great.
Excellent. So let's go ahead and have you begin therapy.
Yep.
And while we do this, I'm going to quickly go, I think, into our live stream here. Yeah, it looks like I was able to answer Robin's question. Yeah. So I think hopefully you'll be getting your, I think it's a hand mentor, Robin, maybe it's a foot mentor. Let me know in the live stream here. Yeah, it'd be great to see you get to those 3 hours a day. I think just as a point of caution, make sure you're doing it in a rational progression, right? You don't want to necessarily go out and run a marathon on day one. You might want to build up slowly up to those numbers. So just be cautious there. So George, you can go ahead and hit play for me.
Okay. Play.
Yes.
Thermometer.
Very good.
You got it. Okay. Now my question is, do you push up first, down first, or does it matter?
So this is very much like the hand mentor when we're trying to reduce tone in our flexors here. But with the lower extremity, what we're trying to do is reduce the tone and reduce the tension in our calf muscles. And so in this case, you want to go up like you're pointing your toes to the sky. That's going to be the main one.
Okay. Yep. Got it.
Exactly. So lower temperatures is good. That's what we want. Okay. And so the idea here, George, is to hold that position for the duration of that stretch until it tells you to relax.
Okay. So,
yeah.
so in this case, I should push down first and hold that.
No, you want to pull your toes up to the sky as far as you can go. Yep.
Got it. Okay.
So lower temperature is better.
Okay. Well, it says 400 at the bottom. So.
Yes, exactly. Yeah, I know the visual cue is a little bit reversed, but the idea is to pull your toes to the sky. The idea behind this was that temperature would be lower when you had lower tone. So that was kind of the idea with it.
Okay, fine. Okay.
Yeah, but you were doing it exactly right. 400 is better than 100 here. So very good.
Thank you. Because you don't get any points for 100. So
exactly. Yep. You don't want to cheat yourself for points.
And in this case, you want to hold that as long as possible.
Yeah, again, this is an idea. The idea behind this is to stretch out those muscles for passive movements to kind of reduce the tension in the passive tissues, but also help kind of alleviate some of that tone, that neurologic hyperactivity by holding that stretch for a while.
Well, Doc, listen, I do acupuncture every week.
Okay.
At Durham Integrated Medicine. And the practitioner there has had a lot of experience with helping with to reduce spasticity. And it seems that in the leg, that the ankle area and the lower part of the shin is what hangs on the longest. And so it's the hardest to reduce, and it takes longer.
It is. And that's one of the reasons why we've talked about this in the past. I think Dave actually asked me this question maybe a couple of Rehab Power Hours ago about foot drop is not just simply a lack of activation in your tibialis anterior. It's also the fact that the calf muscles are overactive. So those two things compete against each other to actually make the foot drop even worse. And so often what happens is you'll get that hyperactivity in the calf, and that will cause you to point your toes. And if your tibialis anterior muscles are too weak, they can't counteract it. And so I think often what's happening here with George is we're doing both things at once, right? We're actually strengthening your tibialis anterior, and we're reducing the tone in the back of your calf.
That's very interesting because in the hospital, a neurologist I dealt with at Duke was this with the hemorrhagic stroke, which affects the left side in this case. With a stroke, your body tends to either push away, in other words, pointing that toe, or retracting, one or the other.
Yeah, it depends on, so the upper extremity, you're exactly right. You adopt this flexion posture, which is called a flexion synergy, and that's different than the lower extremity. The lower extremity tends to extend. So that is, there's the upper extremity and lower extremity are a little bit different usually.
Gotcha. Yep.
So let's go ahead and hit next here, George. And actually what I want to do is I want to go ahead and get to a couple of those games that you're having trouble with. So let's go to Plinko, actually. Let's see if we can get to that.
Well, yeah, because it hasn't shown up in my rotation of games yet. So,
yeah, that's okay. And if it doesn't show up, we'll try to I'll make sure we can troubleshoot that later. But I want to get to Solitaire. If that one shows up, we can go through and troubleshoot that one.
Okay. Yeah.
Okay, so we'll go ahead and skip this one real quick.
Yeah, no worries.
Okay, very good. Okay. And just as we transition here, guys, I want to just quickly welcome everyone back. This is your Rehab Power Hour. I'm your host, Dr. Nick Housley. So thanks so much for being here on this Friday evening. If you have questions for me or my guests, let me know, and we'll be sure to answer them. So that number for calling, by the way, guys, everyone, it is 404-594-4244. So feel free to give me a call and leave me a voicemail. I'll be sure to answer your question on the air. So George, you can go ahead and actually skip this game for me, and we can go to our.
Yeah, sure. No worries.
Yeah, we can go. Yep, very good. Okay.
Well, and I think that the questions I had a while ago about the range of motion with the slot machine would be alleviated with what we just did. So.
I think so too. George, what I was looking at beforehand, when you on your data, it looked like there was a hard cap somewhere, and that tells me that there's an issue on the hardware side, and which kind of led me rather to investigate those two latch systems. It
Sure.
could have been either of those that could have caused that problem, but I'm glad we were
Yeah.
able to fix that.
Okay. Thanks. This is good, man.
Yeah, very good.
I do have a question.
Sure.
We can either do it for later or now, but when I ordered this, I just used my credit card and I got the first month. Okay.
Sure.
But talking with Matt from Matthias.
Yeah.
Okay.
Sure. Well, George, while you do this, go ahead and press the skip button. We'll get to our Solitaire. Yeah.
Okay.
That's okay.
That's good.
So you were talking.
Yes.
You're talking to Matt. Okay.
Well, here's the thing. Obviously, I'm on Medicare and so forth, and that is I need to find either a provider or a PT person in North Carolina. I know I'll get an email with a prescription in it, but I need to find someone in North Carolina that can actually do this prescription so Medicare will pay for this.
Yeah, understood. I think what we can do, George, is we can look through the existing provider dashboard that we have in the existing provider database, and we'll be sure if we have. I don't know specifically if we have anyone in New York or North Carolina.
But I didn't find anybody. So okay.
Okay. Well, I'll keep sure to I'll be sure to look through it again to make sure we don't have anyone.
Okay.
And if we don't, what we'll do is we will make sure to post about that as well. Also, guys, in the live stream, if you know any providers in the North Carolina area, whether it's an occupational physical therapist that you think would be good to use telehealth, let them know we're here, and we are happy to train them to use the hand mentor or foot mentor. And this could not only help you, but it could also help George and other people around North Carolina engage with the hand mentors or foot mentors. Also, you guys, just as a quick mention, if you do have an HSA or a health savings account, you can also use that as well. I know some people have been asking about that, and that is a viable option as well, guys. Just to put that information out there.
Right, and right now, Duke has their own system called Experience Health. It's managed through Blue Cross and Blue Shield for Medicare. So I've talked with them and provided the information from Motus Nova, and they'll run that up to the Medicare management team and try to get, because Duke is and the my acupuncture therapist, acupuncture provider, Duke has got Duke as a health system. It's huge, as you well know.
Yeah, and the big medical provider. That's correct.
The telehealth aspect of this would be phenomenal, because I know when you started out, you were dealing with veterans and out in the boondocks and so forth, and so so it would be. But Duke, as a health provider, wants to make money, so they need to be able to monetize this in some way. So if you have a telehealth in the home, then that PT/OT person.
Yeah, we would be happy to talk with anyone who is at Duke. We've always been open to talking with any healthcare provider, whether it's a small individual sole proprietor or a large institutional hospital system. We are very happy to work with them and to try to basically help their patients gain access to these rehabilitation options. If we're happy to always do that. So if you know anyone specifically at Duke,
I can set you up with the head PT at Duke. Okay.
That would be wonderful. Thanks, George. Actually, so it looks like we came up to the Solitaire here. So let's go ahead and play this real quick. Let's see if we can figure this out together.
So play. All right. I know I'm supposed to use my fingers to touch a card, but then I don't know where to go from there. Okay.
Okay, that's fine. So George, do you see a play here that you can actually do? It looks like that 6 will work, right?
6 will go to
7. The red 7. So what we'll do is we'll touch the 6. There you go. And then touch the 7 one more time.
Okay.
So you have to initiate which card you want to move. And then you have to select the card you want to move to card 2. And then what you do is now you see those green arrows on the left-hand side?
Yeah,
go ahead and move your foot. Yeah, push your foot down all the way.
Okay.
Very good. Almost. Keep going, keep going, keep going.
Got
Almost there. Very good.
Oh, you got to hold that.
Yeah, you do.
Some of the stuff I was doing earlier before I got on here was I was having to hold it down for 20, 25 seconds, almost 30 seconds.
Okay. Yeah, we don't want to do that. So I'm going to make a modification here, George. That's me. So go ahead and hit play again for me.
Okay, no worries.
Okay. Now you can go ahead and move up as far as you can. Move up, move up, move up. Very good. There you go. I think what happened, George, is that bottom setting was a little bit off for you. So I think you should be able to play it just fine now. Now, I don't see a play here, so you can go ahead and maybe hit the top left of the deck, and we'll see if we can get another play. Let's just check again, maybe another one.
6 on a 7, right?
I don't think that's going to work because they have to be off different colors, right?
Oh, okay. I forgot about that. I hadn't played this game in a long time, so.
Sure. Yeah, I hadn't either until my the engineers and the game designers were like, "Hey, Nick, let's play this." So I think that queen. Let's go ahead and try to play the queen on their king.
King. Okay.
Okay. Let's make sure we can do it again. And then all you have to do, remember, George, you have to press where you want to move the card to.
Oh, got it. Sorry about
highlight
that.
the queen and then press the. There we go. Very good.
Oh, that's cool.
And then it's going to ask you to move down all the way. Move down. Move down. Move down. Very good. And then move up. Boom. I think you got it, George.
I got it. Okay. Next.
Very good. So what I want you to do, George, I want you to go ahead and continue playing here. I'm going to move over to our next Spotlight user, but I'm going to come back in just a few minutes and we will we'll debrief and see if the changes we made today are helpful. Okay.
Well, I can already tell you they are. I just need to figure out how to play Plinko.
Okay, very good. Yeah, we'll make sure we can get Plinko on to you. Okay.
That's great.
Very good.
Okay.
Thanks so much, George. I appreciate it. And we'll be back in just a second. So let me go ahead and just reintroduce everyone. This is your Rehab Power Hour, and I'm your host, Dr. Nick Housley. Thanks so much for being here. If you want to reach out to me, you can leave me a message in the live stream here, or you can give me an email at rehabpowerhour@motusnova.com. Alternatively, you can give me a call at 404-594-4244 and leave me a voicemail. Either your questions or comments. I'd love to hear from you and see how things are going. But for right now, I'm actually going to go over to our next guest. We have Jonas. Jonas, can you hear me?
I can, yes.
Jonas, excellent. Thanks so much for being here with me on this Friday evening. Well, if you wouldn't mind, maybe start off by introducing yourself. Tell me your name, where you're calling from, and when you had your neurologic injury.
Okay, my name is Jonas Webster. Sorry, I don't know what. Can you hear me?
I can hear you just fine, Jonas. Yeah, you're good.
My name is Jonas Webster, and I had a stroke 2010, and I moved down from DC to where I live now in Atlanta, Georgia.
Atlanta, yes, Jonas. I'm in Atlanta, Georgia too.
Yeah, I know. And I'm doing very well. I'm doing very well. I'm doing very well.
Excellent. So Jonas, tell me, how long have you had? You're using your hand mentor, right? How long have you had that?
I've had it for about 2 months. I had it for about 2 months.
Okay.
Now it kept on doing some things, and I'm not sure what it was doing. So sure. I ended up taking it. Somebody ended up taking it to I
think sometimes what happens, we have some technical bugs, Jonas, and so I think that's probably on us.
Yeah, I had to get enough. And so,
well, thanks for sticking out with us. I mean, we know that happens with technology, so apologies for that. But I'm so glad that you're able to still use it.
Yes,
so,
I can now use.
Yeah,
it.
That's really great. Now, Jonas, tell me a little bit. Have you experienced any changes in you, in your arm? Or your hand since you started using the hand mentor?
I have not a lot, but I have somewhat. Okay. Yeah, in my.
What type of changes have you seen, Jonas?
I've seen changes in my hand. I've seen different changes. Not a lot, like I said, not a lot, but different changes in my hand. Now I've done I've done a
Are you doing rehab, Jonas,
I've
outside
done
of the
an
hand
hour.
mentor? Okay.
I've done an hour you know what I'm talking about, right?
I think so. Are you talking about an hour of therapy on the hand mentor, or are you talking about just normal
Yeah,
occupational physical therapy?
an hour on the hand mentor.
Okay.
An hour on
Did you
the
do
hand.
that today already?
I did it. Yes, I did it.
Excellent. Okay.
And I'm wondering if I can do 2 or 3 hours as
Yeah,
well.
Jonas, this is a great question. We actually just had this come in on the live stream here. Robin was asking the same sort of question that you just asked. She asked if it is possible basically to do 30 hours in 10 days, which is basically 3 hours a day. And the answer to that question is yes. And in fact,
Mhm.
when we look at the science, the data, it actually says that the more therapy we can do generally, the better outcomes we're going to have. And so again, this is provided on you are comfortable getting that amount of therapy.
Mhm.
And it's not going to actually cause any problems for you. Yeah, you can get more therapy. I would recommend not going from an hour a day to 3 hours a day. What I
Mhm.
recommend is go maybe starting on an hour, and once you feel comfortable, hey, I can manage this, then I'm going to go to maybe an hour and a half for a couple of days
Right.
and see how I go, and then maybe
Right.
build up slowly like that, kind of stepwise, right?
Right.
A 1 to 3 hour change, that's a rather large
Yeah. No,
shift in the amount of therapy.
I understand.
Yeah.
Um. Um. Yes. And then what he talked about the what you know what he talked about last time,
Who are you referring to?
the guy
Oh,
that's
he was just on. I mean, we were
yeah
talking about some difficulties with range of motion or difficulties with some certain games.
yeah difficult with a certain game.
Okay.
You know what?
Well, which games are causing your problems right now?
It's not causing me problems, but this the same game that he talked about.
Okay. Solitaire?
Yes, Solitaire. Tell me his name
Okay.
again. I'm sorry.
Oh, that was George. George was on just a
Right,
second ago.
George. Yes, Solitary. I'm trying to find. I mean, I know I can do solitary,
Sure.
but I would like to do it a lot of. It's my most.
Is it challenging for you?
No, it's not challenging.
Okay.
It's my most. It's what I really love.
Okay. So would you like, we can
I like a
actually
lot of
increase
things.
the amount of time you do it.
Right. That's what I want to be able to. That's what I want to be able to do. Instead of
We,
going. Go ahead.
excellent. So Jonas, we can certainly increase the time on solitaire. And in
But
fact, this actually goes right along with you wanting to do more rehab. We can just increase the time that you do on solitaire.
what does that mean, though?
So what you were asking earlier about, could you do a little bit more therapy? Could you build up to 3 hours a day? And one of the ways we can do this is we can sort of like slowly build up to more and more time. And if you really like solitaire, let's increase the time that you have in solitaire.
Right. That's what I want to
Yeah.
do. I don't know how to do that.
I'm doing it right now, Jonas. How about that? I'll do it for you.
What does that mean?
So what I'm doing right now is I've actually logged on to your hand mentor, and I'm actually going to change the prescription right now for you. So instead of just 10 minutes right now, we're going to go for 20 minutes on the actual solitaire game.
Okay.
So you'll have more time to play.
I would like 30 minutes.
30 minutes. Okay. Well, I think right now we may have to talk with the engineers about get that a little bit higher. But I think.
But 20 minutes is okay.
We'll start with 20 minutes. I think part of this,
Okay.
Jonas, is that building up slowly. So we'll start with 20 minutes and then we'll build up from there. Okay.
All right. And
Okay.
then next time I'll do 30 minutes next time, or what do you
Yeah, I
think?
think so. Yep. And so what we can do, Jonas, is if you wouldn't mind, we can also go through this evaluation process to kind of see how things are going for you, to kind of just see what numbers you have, and we can make some modifications on terms of your range of motion. How does that sound?
I'm not sure what you think.
That's okay. No, so one thing I want to make sure is that your hand mentor is fit well for you.
Oh, okay.
So the ranges of motion are appropriate for you. That assessment process can be very helpful to make sure you're going to get the most out of it.
Okay, I got you now.
Yeah. So on your end, do you have your hand mentor powered on?
I do, yes, but I have powered on.
Okay. Now, what do you see on your screen right now?
Right now, I see
Do you see a begin therapy button in the center?
I see the no, I see the begin therapy and the end therapy.
Gotcha. Okay. Well, on the left-hand side, if you wouldn't mind, there's a button that says like My Telehealth. Go ahead and press that My
Yes.
Telehealth button.
All right.
Okay. And then that should bring up a couple new buttons. And then I want you to hit the assessment button for me. Okay.
It's not doing it.
Do you
Okay.
see the assessment? Let's see here.
Okay.
Let's see if we can turn.
Say it again.
Okay. Can you press the assessment button for me?
Yeah, it's not.
Okay.
It's not doing it.
Would you mind maybe turning the camera so I can see what you're seeing? There we go. Okay. Okay. And then on the right-hand side, you see the purple buttons? On the right-hand side, there is an assessment button.
Yes.
Okay. So what happens if you press that button?
Okay. Oh, I
There we go.
see. I
Okay,
see.
very good. We are on the right page now. Okay. So I'm just going to quickly look at your data right now and see what's going on. I'm going to clear this. And what I'd like you to do you have your hand mentor on your right side?
My hand mentor?
Yeah. Do you have the hand mentor on you?
Yes, I do.
Very good. So what we'll do is I'm going to have you go ahead and we'll start the process of going through those ranges of motion for me, okay? So actually, we might be having a couple of connection issues. I think that's why we're not getting the video. And so we might be able to do this at a later hour. But what we can do, Jonas, is you can hit the back button on the top left. And actually, I want to go straight to helping you fix those games. Because I know we're kind of running low on time here, but I want to make this really helpful for you. So go ahead and hit the back button, top left. And then hit home on the top left for me.
Yes. Okay.
Okay. And then you can hit begin therapy.
Okay.
Okay. And then once you hit begin therapy, we'll actually walk through some of these individual games. And I want to make sure that are all of them fairly easy for you? Are any of them challenging for you?
They're all easy.
They're all easy. Okay. All right.
They're all easy.
Okay. And so maybe we can walk me through. I don't know if it's possible, Dennis, because we're not able to get your video. Are you able to hold the screen up for me so I can actually see what's going on with your hand mentor? Okay, very good. So it looks like we're on Strongman there. Okay, very good. And then you can hit play.
Okay.
Let's just go ahead and yeah, very good.
Yeah. I know how to do this already.
Very good. And one thing I do want to do though, let's go ahead and check to make sure that you do have the Solitaire has actually hit that larger amount of time. So we can go through and skip that. Skip until we get to Solitaire and make sure we actually have the amount of time that you would like.
Okay, how do I do that now?
So you can pause the screen by touching it, and then you can hit the skip button. And you'll have to skip through until you hit Solitaire. Yep.
All right.
So I see a question here. While Jonas is skipping through this, I'm actually going to answer a couple of questions that came through in the live stream here. We have one from Candace here. Candace is saying that about 16 and a half years ago, I had a brain aneurysm and then 5 brain surgeries, seizures and paralyzing stroke when the doctor put the platinum coil in my damaged blood vessel. And she said she had no therapy for 15 years. I mean, thank you so much, Candace, for telling us your story. I'm so sorry to hear that you've experienced this. But I think one of the questions that you're asking here is, maybe one of the questions kind of embedded in this is, could you benefit for something like this? I know many people are told that after a year after your neurologic injury, whether it's a stroke or traumatic brain injury, that you can't recover anymore. And this is really just a big misrepresentation of the data. And really what happens is we know from all the clinical trials that even if you're past a year, we see time and time again that people are able to recover. And in fact, this is, as you guys probably well know, this is one of my big motivating factors. And one of the reasons why I got into this is that I'm helping people who have chronic impairments. And in fact, this is one of the ways that the stroke or the hand mentor is actually studied primarily. And we focus a lot of those clinical trials and large implementation studies on individuals who have chronic impairments. And so we see time and time again that the hand mentor is able to help you recover functional abilities even 10, 15 years after a stroke. And so I think it would be a great option for you to try this, Candace. And of course, I should always qualify this by saying every neurologic injury is different. And it's going to be really hard for us to sort of predict exactly what type of experience you can expect in terms of functional improvements. But we do see people make meaningful improvements in their use of their upper extremity following use of the hand mentor. And so I think David actually was able to answer some of those questions about the reimbursement side. And so I think let me just quickly go through this. Yeah, and David is exactly correct, right? Unfortunately, right now, insurances are not actually paying for the hand mentor itself as a robotic device, as a therapeutic device. But as David suggests, the therapy that's covered by it as it's delivered through a physical occupational therapist, can be covered by most major insurance providers, including Medicare. So hopefully that helped to answer those questions, Candace. Okay. And I'm actually going to quickly remind everyone before we kind of finish up here that we do have that contest going on right now. And just to remind you guys of that, the main idea here is for us to get a sense of what type of functional improvements you're making. And so what you have to do is just send us a video, 60 seconds or less, of you using either the hand mentor or the foot mentor, or you doing a functional task. You can submit that video to ella.sophia@motusova.com by the end of the month, and you'll be entered in to receive a free month of the subscription of either the foot mentor or the hand mentor. So it's a kind of a really
name Siddharth Kaul.
more often.
I'm calling from Hillsboro, Oregon.
2021, and hopefully you guys
My
will be there
question
to
is,
work with us
I
and send
had
us those really great videos, and we're always
name
excited
Siddharth
to hear
Kaul.
what's going on with you guys. and
I'm
see,
calling
what
from
type of progress
Hillsboro,
you're making.
Oregon.
So
My question
also,
is,
I'm going to quickly ask,
I had
see, we are kind of running down our
I
last
have
couple minutes
got
here, so just if you have any final
Motus
questions or
handman.
comments, do let me know in the live stream here. And I may not be able to answer it today, but we'll be sure to answer that on our next Rehab Power Hour, which is scheduled for Monday at 8 p.m. And actually, I think we have Dr. Wolf coming back on. And like he promised a couple weeks ago, he's actually going to bring in some data from individuals' brain scans after their use of the constraint therapies. And so we'll be able to actually see the meaningful changes that happen after doing a repetitive task practice intervention, just like the hand mentor. So really excited to talk to him about not only that data, but also to kind of reveal what numbers people are actually getting on with respect to normal therapy, how many hours and how many movements you're actually doing in traditional therapy. And we can kind of compare that to what's really needed with respect to driving improvements in your brain, as well as what we're getting with the hand mentor or the foot mentor. And so I'm actually, before we end up really quickly, I'm going to go back over to George and see if George is still there. George, can you hear me?
I sure can hear you, and I'm playing Plinko.
Very good, George. Yeah, I was able to get that on your prescription, I think. And so hopefully
actually,
it looks like you're able to play it. Oh, go ahead, George.
Actually, it was already there, and I was playing it. I just didn't know the name of the game.
Oh, okay. Yeah, I updated your prescription to make sure it was there. I did see it there, but sometimes it can be a little bit buggy. That's okay.
It's there, and it is my favorite game, without a doubt.
Very good. Very good, George. And so I think, tell me about, I guess, the changes. We made some improvements in your ranges of motion. And so tell me how those changes are responding to you.
Extremely well. Thank you.
Very good. Yeah,
yes,
I'm glad to be able to help. And sometimes the simple solutions are always best.
Can you tell me?
Yes,
can
they
you
are.
Tell me what Pinko is?
Plinko.
Yeah, so that's Jonas actually. So Jonas, Plinko is one of my favorite games too, George. And it's actually kind of inspired from that daytime show where you're able to, I guess, one of those Price is Right sort of games where you would normally sit above the actual Plinko board and you would drop in this case, it's a Plinko disc down a slotted path. And so I think
I know what it is.
Yeah. Okay. And I think and actually, Jonas, I think you do have Plinko as well. And so that's the one that has kind of a...
I know what it is.
Yeah, it's kind of has an orange background with kind of orange circles,
Right.
and you can, yeah, very good. Okay, and so guys, I'm going to ask you, George, any sort of final questions before we wrap up?
No, I'm good. And right now I'm at 90,000 points. So
Very good, very good.
how about that?
Pretty
There you
good,
go.
I'd say. Pretty good.
Oh, there you
And
go.
yeah, Jonas, any final questions, Jonas?
I want to know, like for different things at the like Pinko and different things. Is there any way I can play like Pinko or any other things to by can I pull up, or does somebody have to pull it up?
Yeah, so that's a good question, Jonas. I think right now the way we can do this is just if you want to have a modification, you can always call support, the support team at Motus, and they'll be able to make those modifications for you in terms of which games you're going to be doing. Alternatively, you can actually just come back on Rehab Power Hour, and you and I can make these modifications together.
Okay. All right.
Okay.
Okay.
Well, thanks so much, guys. Well, I'm going to actually quickly go over, I think I have a question here from Siddharth, I think. Apologies if I'm mispronouncing your name, Siddharth. I think he's asking that if a hand mentor does anything to help with side-to-side lateral movements of the fingers, or does it only go up and down? And I guess the same sort of thing with the foot and the ankle. So good question, Siddharth. I think with respect to the hand mentor, it does go up and down into this flexion extension plane of motion, and called the sagittal plane, really. And the movements are restricted to that plane of movement. But what's interesting is it actually helps you in movements. It helps you improve function outside of that range of motion. And the reason it does this is a bit complex. You have to think about the anatomy, specifically in the muscles. But what's interesting is if you're trying to do motions that are outside of this plane, all you have to do, all the same muscles are controlled on either aspect of our forearm here in our elbow. And so with respect to the extension, if you wanted to move outside in maybe a circular pattern like this, all you have to do is you have to contract the muscles in different segments because they're operating all about the actual wrist in different planes. They're what's called their moment arms are a little bit off sagittal. So when you want to move up and down in the sagittal plane, all you do is you activate them synchronously in a block, and that pulls all your muscles and all your tendons tight, and you move up into extension. But if you want to go, let's say, up and in, or up and to the left, in my case here, you contract the left-hand side of muscles more than you contract the right-hand side of the muscles. And so this is why we actually see improvements in off-sagittal movements, because we're training all those muscles to work, and we're giving them the big sort of foundation, the range of motion and the strength. And then what happens is those easily translate into more complex, more nuanced control. The same thing happens with our flexors here specifically too. But we do see improvements outside of those normal ranges of motion. Now, with respect to the foot mentor operates in multiple planes. It can go up and down, just like the hand mentor can, but it can go kind of side to side as well, and kind of go in these curved or curvilinear paths. The technical terms for these are pronation and supination, which is a combination of plantar flexion and inversion, and a plantar flexion and an eversion. So these sorts of things are possible with the foot mentor as well. And also, I think, let's see here, I'm thinking we're going to get some final questions here. Let's see, we have one comment, I think, coming through to Candace about the Bioness being covered by insurance. Let's see here. So it looks like the question here, I guess I'm pulling it up. It looks like Candace is mentioning that insurance would pay for Bioness equipment in Dallas Hospital, but my wrist won't extend far enough, so I can't use it. Okay, Candace, this is a good question here. I think Bioness is a sort of device. It's a neuromuscular electrical stimulation device, or an FES device. And I will say this: certain insurances do cover these types of devices. And I think there are ways that you can do this, and generally they're fairly intense. You have to write what are called letters of medical necessity to request this. And many times insurances will not actually cover it, even though they say they will. Oftentimes it won't really happen. Especially for home environments. And so I think it's barely a 50-50 shot, if not much less. And so I think that just because they say it will happen doesn't mean it actually will. So I would be very cautious with that. And it may actually only be covered in the hospital system, in which case you're not going to get access to that in your home environment. So I would make sure that if you are trying to go down that path, that you do make sure that it is fully covered for you wherever you intend to use it. If that's in the home situation, make sure that it's going to be used and reimbursed for you in the home. Oftentimes there's still a fair amount of payment that has to be made by you. I also will say this, with respect to your hand not being able to extend, that indicates that you might be an individual with maybe little to no active movement, and that's okay. In that case, an FES device may not be appropriate for you because it triggers off of electrical activity that you would otherwise put out. And so something like maybe the hand mentor could be a good fit, where you don't necessarily need that initial sort of volitional activity to engage in it. That could be a good option for you to try in your home. So yeah, it looks like Candace is mentioning, yeah, the therapy is in the hospital. That's exactly right. Yeah, oftentimes most insurance providers will not pay for these things like the Myoma or the Bioness or these sorts of devices for home deployment. So it can be really complex. And so that issue of the extension, I think, is a much more complex one, in which case the Bioness may not be appropriate for you. You may need to begin to build up that volitional control to start with. And I think that the hand mentor in that case could be a really good fit for you because it works on that principle, right? You don't have to have that initial condition, such as extension, in order to do this. So very good. Thanks for that question, Candace. And hopefully I was able to provide some clarity there. I will also mention this quickly, guys. We've talked about this before, but the interesting concept of FES versus a therapeutic device like the hand mentor, they are fundamentally different. They're not necessarily antagonistic to each other, but with respect to the FES systems, very much like an AFO, right? It will help you transiently get function back, right? It will provide, it will augment your muscular activity by basically shocking your muscles to cause them to contract, but that doesn't necessarily mean that you will have lasting improvements when you take that FES system off, right? It's just like if you were to sit in front of a piano that played itself and the music came out, but then maybe a week later you were asked to play that same piece of music, you would not be able to do it, right? For us, we are really trying to teach you how to play that piano, that piece of music, in which case you'll be able to do that long after you have the hand mentor or the foot mentor. So I think it's a good question and good clarification there. So I think Candace is mentioning that she says, my hand won't extend because I have fallen several times and wrist hurt and several, okay. In the foot, it looks like she's also has some foot drop issues too. So yeah, I think this is a little bit complex, Candace. Maybe it might be good if you like. I'd love to have you on Rehab Power Hour, and we can chat about this and talk about what might be a good situation for you. So maybe on Monday we can have you on Rehab Power Hour and go through some of these concepts, go through some of these questions. So let me know in the live stream here, and we'll get I'll get the team to get you on Rehab Power Hour. But I guess as always, we generally go past our time, and so I just want to thank everyone for being here. And George or Jonas, any final questions for me?
Thank you very much for having me on. And this is right now the system is working, I think, ideal for where I am right now. And I'll certainly will be able to determine if further adjustments might be made going forward. So, and I appreciate it. And who do I contact with? Who do I speak with so far as figuring out how to get Medicare to pay for this? That's my question.
Yeah, I think the thing, like I mentioned earlier, we have to look into our database of providers, and we'll do our best to reach out to providers in North Carolina, some of our contacts, and see if they are going to be willing to train and learn how to do telehealth through the hand mentor, or for you the foot mentor. Yeah, so we'll be sure to have our team reach out to you as soon as we know anything. Okay.
Okay. Yep. And I'll send an email in just as a reminder and to follow up. I'd appreciate it. Okay.
Yeah, very good. Yeah, we love emails. So let us know. Let us know your thoughts and remind us. We're happy to receive those comments too.
Good. And if I find a PT here that's interesting, I'll have them get in touch with you. All right.
Very much so. We're always interested in talking with new providers. You know, if you have someone there at Duke, that would be good. That would like to learn how to do this. Let us know. Love to talk to someone there.
Thanks so
Okay.
much.
All right, George. Thanks so much for being here.
Good.
And Jonas, thanks so much for being here as well. I want to thank everyone for joining me on this Friday evening. You gave me some great questions in the live stream, and I look forward to seeing you guys on Monday for our next session. It is at 8 o'clock Eastern with Dr. Steve Wolf, and I think my co-host David will be back with me in the studio. And I guess until then, guys, I hope you have a great rest of your evening and a fabulous weekend. And I look forward to seeing you guys all on Monday.
How do I do this? How do I get the how do I come to on Monday? How do I
Yeah, so Jonas, what we'll do is we will reach out to you and we'll send you a link to join in our Rehab Power Hour on Monday. Okay?
all right.
Okay. All right, Jonas, thanks so much. And I guess everyone, I hope you guys have a great rest of your evening and a good and fabulous weekend. And I will look forward to seeing you on Monday at 8 p.m. Join me there and I will see you then. Okay. Bye, everyone.
Thank you.